In this video, I'm gonna show you how to do the 7-site skin fold test. The purpose of this test is to determine body fat levels with the measurement of the skin fold thickness. It is important to remember that all measurements should be taken on the right side of the body. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. Maintain the pinch while reading the caliper and wait 1 or 2 seconds before actually reading the caliper. Take duplicate measures at each side and retest if duplicate measurements are not within 1 or 2 millimeters. Remember to rotate through measurement sites to allow time for skin to regain normal texture and thickness. For the tricep side, it is going to be a vertical fold on the posterior midline of the upper arm, with the arm held freely to the side of the body. For the subscapular side, it's going to be a diagonal fold at 1 or 2 centimeters below the inferior angle of the scapula. For the one on the chest, it's going to be a diagonal fold. However, for men, it's going to be 1/2 the distance between the anterior axillary line and the nipple. And for women, it's going to be 1/3 the distance between the anterior axillary line and the nipple. For the mid-axillary, it's going to be a vertical fold on the mid-axillary line. The abdominal side, it's a vertical fold 2 centimeters to the right side of the umbilicus. For the suprailiac side, it's going to be a diagonal fold in line with the natural angle of the iliac crest. Finally, the last side, it's going to be on the quadricep, and it's going to be a vertical fold on the anterior midline of the thigh. Also, it is important to remember that there are factors that may contribute to measurement error. For instance, poor technique or inexperience, extremely obese or lean subject, or improper calibrated caliper. Also, keep in mind that a woman on her second trimester of pregnancy, a 3-site skin fold test would be more appropriate, including the tricep, suprailiac, and the thigh.